discuss with our panelists here, just to see what are some of the policy interventions that are coming from government. Will the government also, or the parliament be adjourned as it stands? We want to know also, why is the government mealy-mouthed regarding some of the advance team that went to Rome in preparation of President Uhuru Kenyatta visiting the Pope in Rome? We've not been told where they are, who they are, or where they're quarantined, in which isolation they are. So we want to know also from the government, who are these people, where are they quarantined, and what intervention so far has been taken. This is something that we need to know as a country. And of course, also, there is one bill that has been sticking in Parliament. I think it's in the Senate right now. This is the disaster management bill. I think this will be a providential time as well to try and steamroll this particular bill in light of what we're going through as a country. So I want just to begin with Otiende Amollo. So far, your observation, we had discussed earlier some of ramifications that and interventions that are coming from the counties. We can see Governor Oparanya in Kakamega has also informed the county of Kakamega that the Kakamega morgue will be closed and remain closed, and people who have their relatives or, you know, some of the family members in the morgues should actually get them and bury them speedily, just to try and control also the capacity of a morgue as it stands right now. So people are reacting to this, they're thinking he's overreacting as far as just the hygiene is concerned. Otiende Amollo, for them that didn't join us at the top of the hour and they're waking up to this news.
Thank you. Dubal, before we come to the current, let's very briefly go over the recent history.
Yes. The
historical landscape. First, in terms of the reaction by government, I would say it's twofold. Initially, the government, especially the executive, was a bit slow on taking off.
Yes.
As you remember, it took the intervention of the judiciary to stop certain flights, to order quarantine, and in this show, we decried that inaction by government.
Yes.
But I must say, from that point henceforth, the government became quite proactive, and even to date, a lot of the measures they have taken are commendable, and we will examine them. Secondly, remember, it was in this show that we examined the question of the students who are stranded in Wuhan. And, you know, some of the colleagues in this show, like Dr. Halwale, you know, thought that the government was being reckless by not bringing the students back. You remember, I was quite categorical that on that I supported the action of government to let the students stay where they are. They were actually safer there than coming back. I'm sure today, if they were to be asked whether they want to come back to Kenya now, when the infections in China have drastically declined and ours are rising, those very students would refuse to come back. They would perhaps say, let them stay. So the government got that one spot on. It is only a few weeks, 2 weeks back and a week ago, when we were talking about the issue of, you know, Africans of African descent being infected. And there had been all those talks of, oh, you know, because of the melanin, yes, we are immune and all that. I think in just 1 week, all that has come to burst. We have over 328 infections in Africa in less than a week. And with the numbers that are now showing, in another 1 week, it will be much worse off. And therefore, that mindset of imagining that this was a problem of another part of the world, which will not get to us, we must drastically readjust our thinking. I have, up to, well, about 4 days ago and all, we were quite comfortable that all we needed to do was to have that temperature machine at the airports and all that, and you'd come in and they check your temperatures. It is now clear that that is insufficient, because even the first cases in Kenya came through the airport, and they came through those temperature machines. And it is clear, as you've said, that even in several African countries, not just African, several countries, people who are actually carriers and who are sick have gone through those temperature scanners without raising an alarm. And what this means is that we must now find what else we can do more than just the temperature scanners, because that's all that we have. But on a light note, as I finish that segment of the history, you know, we had said that nobody can stop reggae. And I see one of your writers, Langat, on page 8, saying that is not true, because the virus, the corona, has stopped reggae. You know, I mean, he's spot on but wrong. We had said nobody can stop reggae, and still nobody has stopped reggae. Corona is not a person. Corona is a pandemic. So reggae will go on in its time. But now, let's come to the current.
Yes.
There are a number of measures that have been taken, and I think they are all laudable. But let us start with certain of those measures, like the one we are talking about of Kakamega County. I think the various counties have taken different measures. These measures are good, and they are almost all majorly laudable. Sometimes some may be counterproductive, like I've said about the morgue, but I think it's important that they are all consistent and coordinated. You don't want a situation where one county takes this measure, the neighboring county takes a different measure, because Kenyans are not restricted from movement and action across counties. It is important to remember, and the government must remember, that health policy falls for the national government, health policy. This is a pandemic, and therefore it's a health crisis. It is important that whatever the national government does, whatever the county government does, they are all coordinated and consistent. That is one. Two, while some of these measures, like the measures taken by the Minister for Transport, Macharia, are actually quite good and they're proactive, they may need to go further. For example, when he says that there must be public transport vehicles must avoid congestion, that is good. But we need now to go further. The regulations that say that if it's a Nissan, the maximum carrying capacity should be 14. We should now state, he should now state that for this period we have adjusted. Each Nissan can only carry, say, a maximum of 7. So that, because otherwise the congestion is a very subjective term. So if they are 13, if they are 12, are they congested? We need to specify numbers. A 33 capacity vehicle can only carry a maximum, say, of 18 or 14 or something like that.
Yes.
And there should be no crisis, because in any event, most offices are closed. That's one. Two, the question of requiring vehicles to fumigate is a good one. But it becomes a discretion, because how will you tell that, even a policeman, how will you tell that this vehicle has been washed twice, that it's been fumigated? This responsibility needs to be centralized. We need to have inspectors on every route with fumigators at the expense of national government.
Yes.
Where when you get there, all the passengers are asked to alight, they are sanitized, the vehicle is fumigated, they go back into the vehicle, and it continues. To leave it at the effort of the owners is to leave the public health of the passengers at the hands of people who may not always do it. Thirdly is the question of sanitizers. I've seen that the CAK has cracked a whip on a particular
clean shelf.
Yes, clean shelf for overpricing the sanitizers. The bigger problem, and I can tell you, I even went around a number of supermarkets, is that there are no sanitizers. Forget about the increase in prices. There are none. Most supermarkets don't have them. Therefore, the national government needs to go into a crisis of production and a crisis of standardization of those prices. Because as long as they are not available, people will overprice them. And whether it's a supermarket, what will happen is that if the supermarkets are restricted, people will buy them from the supermarket, as some are doing, and then still sell them at higher prices separately. We need to assume that as a national government initiative. Who are the people who are producing the sanitizers? Are they sanitizers that can actually prevent the spread of the virus? Because there might be others which are called sanitizers, and they are not up to the standard. Because I think they say you know, it's sanitizers that are alcohol-based, you think up to the extent of 60% or something.
Above, yes.
So there's need to standardize and avail that.
But also I think an education needs to be done as far as sanitizers are concerned, and the normal soap, because also we have health experts saying just a normal soap will do.
Absolutely.
We don't have to really go for the sanitizer. I think also
Absolutely.
we paid much premium to the sanitizer at the expense of just soap. So do you think on that particular note also they need to become, or they need to be more clearer?
Yes,
with
of course. We really need, other than just talking about the sanitizers, in fact, even in addition to that sanitizers, we really need to come back to the basics, that everywhere you should provide, which we were always told, some clean running water and some soap, and wash your hands thoroughly at all times. Whether or not you're using the sanitizer, that is a good prevention mechanism. Of course, some who want to joke about this, I saw a friend of mine posting that, you know, some people from my part of the world, when they can't find a sanitizer and can't find soap, they use Glenfiddich to wash. But that is making a joke of a very serious matter. I think we must just encourage people that even if you can find sanitizer, still wash your hands thoroughly with soap and running water. Let the sanitizer be an addition, but let those sanitizers be reliable, because if you might, there are people who take advantage, knowing that people need sanitizers and they're not available. Some crooks will go and make things, you know, that are mixed with some concoction and call them sanitizers, and some unsuspecting Kenyans will buy and believe they've sanitized their hands. That becomes much more dangerous.